Welcome to Ask Dr. Melinda, Aging Gracefully and Strong, bringing you cutting edge trends in holistic and integrative medicine on IQ Podcast. I have the pleasure today of having as my guest Dr. Kevin Murphy, founder of Mindset and a revolutionary non surgical, no drug therapy to treat conditions such as PTSD, autism, and major depression. Dr. Kevin Murphy has a huge amount of experience being a pioneer in this field. And I really want to address he's a radiation oncologist. So you know that he's a pretty smart guy. And he ended up treating going from treating brain tumors to treating the brain holistically. So such an honor to have you here today. Can you please tell us about what is TMS therapy?
Great. Thanks, Melinda. Thanks for the nice intro. I do a work of personalized RTMS. RTMS is a procedure that's been out for maybe 15, 20 years in practice, and it's repetitive use of a transcranial, so through the skull, magnetic field to cause stimulation to adjust neuron frequency. And that process has been FDA approved since probably the mid 90s to 2000 time period for depression and a few other indications. And then we took that technology and attempted to adapt the same technology toward a more personalized approach. And we ultimately coined the acronym PRTMS, which personalizes that delivery of that stimulation.
So what does that actually mean that it's personalized? What makes it personalized? Because I know that you developed a software company, right? Called Peak Logic.
True. The key is to take data, as much data as you possibly can from the brain. And we do that with a wireless EEG, which is an electroencephalogram. And it's a cap that goes over the head for 5 minutes or so and takes 19 different brain locations and takes the frequency from those locations. Then we can plot that. And then a computer can choose how to, in a sense, correct what we see in that brainwave pattern. And it's done over a daily treatment, 20 minutes a day, 5 days a week, for generally 6 or 8 weeks of stimulation. And along the way, we alter the protocol and the delivery techniques based upon the patient's response to treatment. So in some medicines, we start and just kind of push through with a certain protocol. In this case, it's constantly adjusting as the brain's changing throughout the course of treatment.
Now, I got to meet you in your office yesterday, which was really fascinating for me because I got an idea of how you ended up moving from mainstream medicine into this field. And I want you to share, how did that happen? What made you do that?
Well, as a radiation oncologist, I specialized in the brain and in pediatric and adult brain tumors, and in giving a process called stereotactic radiosurgery. And that process is giving high doses of radiation to mostly small targets in the brain, also non-invasive outpatient therapy. And we were finding that some of the patients were having a good response to tumor being reduced, but may have some side effects from the dose of radiation to the adjacent brain. These kids and adults oftentimes had other reasons like surgery or chemotherapy that was causing these effects, but we also knew that radiation by itself was creating some change. Regardless of how that change occurred in those brain regions, the goal was, can we fix it? And so I first started taking my patients who had some injury we felt from our treatments in attempt to cure them and tried to realign the brain frequencies. And that's how things started. It led me to realize that the brain is being treated more like an organ and not the mind, which is typically the way we look at the brain in psychiatry and psychology. In this case, we're looking at the brain simply as an organ, saying, can we make it perform better? Can we make it tuned so it behaves better? And we were finding in lots of cases, we were getting very good results by doing this personalized approach.
And do you feel comfortable sharing your personal story of what actually made it switch for you?
Well, I think that, seeing some of the changes in autism, I think some of the cases that came my way were debilitating cases of autism where kids had trouble even going to school or having any sort of ability to make eye contact or communicate. When you see those things change in those kids, you know that you're onto something because there's no placebo. So in a lot of medicine techniques that are new, we worry about, well, is it just, is there something else going on, or is it placebo effect? An autistic child can't fake it. They can't they aren't sure what we're doing, so they can't really participate in placebo. Mm-hmm. So when I started seeing that, I said, there's something here that you can make maybe a nonverbal or hardly verbal child start to speak more, or to make a person who has musculoskeletal coordination difficulty move better. Those are things that are hard to be called placebo. So we started seeing that. Mm-hmm. And then in brain tumor kids where they had deficits from their treatment that were very profound, we were seeing improvements by giving them this therapy. So to me, that was sort of like a game changer. And I thought we have to get more knowledge about the brain and how it responds to stimulation. And I think there'll be a day when we look at this and say, boy, it's odd that we just let our brains just run forever. We never thought about tuning the brain. Mm-hmm. We fix every part of our body in most cases, or a lot of athletes will focus on the extremities and on otherwise their heart and other organs, but not the brain as much. So this is really a technique that says everyone's brain performs better when it's tuned.
And right. No, I saw the schematic drawing of what you were showing, and if people can understand how the brain works, there's signals that have to pass through the synapse and those signals can be disturbed by trauma, by PTSD, by chemical disturbances. Mm-hmm. And what you do in your treatment is non-surgically, without prescription drugs, you send an electric current that makes the neuron sync. I mean, it seems so simple, but it's magic. Because I've seen these people transform when you make those neurons sync. I mean, like I said, I was able to go to your office yesterday, and I was touched because I brought my son, who's 20 years old, and he was a wrestler in high school. And unfortunately, he suffered from some concussions from being a wrestler, being a contender for state, but having concussions during CIF championship. And he didn't want to tell us that he had a concussion, so he was continuing to compete. And unfortunately, I could see that unfortunately gave him headaches and made him fatigue and made him feel low. And unfortunately, with mainstream medicine, they just wanted to throw prescription drugs at him that didn't work. So I actually had him come see you yesterday, Dr. Kevin Murphy, just to see how this actually would work. And it was very fascinating because I watched him do this painless EEG. He just sat there, and in a matter of minutes, you were able to get this data, this map of his brain. And without even talking to him, you were able to tell him how he felt and what was his day like based on the pattern of his brain. And for me, that was very fascinating because I thought, wow, you could take this data, and now every time he comes and has this painless treatment done, you could see the changes in his brain waves and the changes in his, in how he feels. And that to me was very fascinating. And I thought, wow, this is something that other people should know about.
Well, think of the EEG as objective criterion that we're establishing brainwave function based upon math. And so oftentimes when we do psychology and psychiatry, we're talking about subjective criterion, like filling out forms of how you feel and those things. That's important to know how patients feel subjectively. But it's not really a great test looking at how the brain functions objectively. In other words, CAT scans and MRIs look at your anatomy. They don't say how you're feeling, though. They don't tell you how you're mentating, how you're sleeping. The EEG is a time-sensitive process which gives the data of the brainwaves over time, over a 4-minute span that we take. So what it's telling you is how's the brain functioning dynamically. And that gives you a whole different set of information. So if certain areas are going too fast, it leads towards certain symptoms. If it's going too slow, it leads toward other symptoms. And so when we treat patients, we don't necessarily treat their diagnosis. I don't tell patients they have this or that diagnosis. We don't necessarily treat even those names that they come in with. We just treat their brain. And then the symptoms that they're experiencing from those diagnoses is what we're addressing.
And you're treating symptoms of anxiety, depression, headache,
Yep, sleep.
and sleep, insomnia. I mean,
A lot
things
of
that
focus problems. A lot of patients have a lot of trouble with their faculties as they get older. We can tune those patients up a bit and improve that as well. So it's been very rewarding to see some of those effects. It's uncommon, frankly, to see someone not have a response. I would say in our 6,000 patients we treated over the last 7-8 years, we have a large database, and very few patients would say there's no response. There are cases where, though, there's no, and I know in a couple weeks of treatment that the patient, unfortunately, is not going to respond. They're usually brain injury patients that have had a severe injury. Some of our very far gone Alzheimer's patients, unfortunately, fall in that category too. But I would say the vast majority of patients will say that they're sleeping better, they're calmer, they're more focused, things like that. So it's been very, very rewarding.
Do you see that there's going to be a chance to help patients that have early onset dementia or other memory issues? Do you think that?
Yeah, I would say that the best case scenario are patients like that have just the beginnings of, having some memory difficulty, some focus difficulty. That's what we see in all cases of dementia. It's a spectrum. It starts to move toward more and more difficulties. The earlier intervention, the better. So if we get patients that are just having those problems, we can sometimes almost reverse them and put them back 5 or 10 years in their brain speed. And for your clinic, what I was so excited to meet you about was this idea of brain health and talking about the brain and sort of the non-invasive ways to increase wellness and decrease aging. And so what really happens here is that as we age, our brain continues to slow. Every single day we're fighting gravity in terms of the brainwave. It's slowing. And this pushes that brainwave back up. And we drag that brainwave back to a previous age and see if we can make it stay at that previous age. And very oftentimes we can. And we just, in a sense, reduce the brain age by bringing patients back to a faster frequency. Brain age, at least in terms of frequency. How fast does the brain fire?
Well, I love that idea because, brain is like the final frontier, right, in medicine. And I'm definitely interested in trying it for myself just to see, because as I get older, I've noticed that brain fog, right?
Yeah, exactly.
And in my practice, it's very common as we get older to have that brain fog. And if we could do a simple treatment that is going to be non-invasive and safe, then it's something that I definitely would like to try for myself. What is the safety of this treatment? How have you seen anybody have any side effects, or is it because when I saw you perform it seemed pretty relatively benign?
It's extremely safe. The process of standard TMS is considered very safe and gives about 4 times the intensity that we give. So we're giving a depth about a logarithm less of energy to the brain and getting better results in our view and others by being a little less aggressive in the approach. So we give a little more dose, but we give less intensity. And even in the cases of standard TMS, it's very, very uncommon to have side effects, very well published, lack of side effects. In our case, we're seeing even less because we're not giving that same intensity. We're also personalizing it according to the patient's own brainwave. So patients will say to me, "Are you going to change my son's personality?" And I said, "We're going to make your son more efficient." So that may change his personality, he's more efficient, but it's going to be in this positive direction of essentially think of what we're doing as improving the efficiency. Just like you would when you tune something, it performs better. So I've had people say, "Well, how can you treat autism and then treat, these military personnel?" Different folks with different outcomes in a sense, but they both have a brain. And what we're saying
Didn't you tell me that you were able to treat performance as well? Like was it for athletes or military? Can you speak about that?
Yeah, we do. I mean, we
have about performance enhancement.
I think the most predominant thing that improves with patients that get PR TMS is that they have improved sleep. And their quality of sleep is better. Their nighttime awakenings goes down. If they wake up, they can fall back asleep. That goes along with anxiety. Sleep and anxiety are linked. More anxiety, of course, less sleep. You reduce anxiety in patients in the first week of the treatment, and they sleep better.
Wow.
And when the brain
The
sleeps
first
better,
week, the
first week,
anxiety is
you
better?
change the anxiety.
Wow.
As a matter of fact, the majority, I'd say 80% of our anxiety reduction overall occurs in the first week or two, the first 10 treatments. We see the biggest jump, maybe 80% drop in their anxiety. So that's kind of what we're looking at to make sure patients are responding. We don't treat patients and find out at 2 months, I'm sorry, you didn't respond. The patients tell me that they respond.
Right.
It's their experience that matters, not mine. I can say your brainwaves look different, your scores look better, but they're going to tell me that this is working. And so that's a bit different than some medicine. In standard TMS, you're really driving the brain, overpowering it to a new frequency of 10 hertz. We don't think that's the answer. We think the answer is let the person's own brainwave be amplified. And finding out what that brainwave is takes some effort and time, and it's a bit complicated, but it moves. It never stays the same. So we're always kind of chasing the patient's predominant wave. That's why I think our results are better. I think we're having a more personalized approach, and we change as the patient's brain changes.
Well, I see that you have centers that use your services all over the country, from
Yes.
Hawaii to Texas. So how many patients how many EEGs have you looked at across the country?
Many, I would say, since 2007, or I'm sorry, 2013 is when this new program really started. We had maybe 30 or 40,000 EEGs since I started doing this. The last 4 years is the majority of those. As we started to do this work, we had to have an automation process to automate, to help a doctor in Texas or Florida or New Hampshire do this on their own. And so we've developed a company called Peak Logic. Peak Logic is a software company that takes the data from those various locations that we HIPAA compliant server. We can then adjust the frequencies and adjust a protocol and send it back to that doctor wherever they are. We have a lady here from yesterday from Dubai. I think we're going to be hopefully starting something there. So it doesn't really matter where they are, as long as they have internet access. We can take their information, we can process that data, send it back to the patient's physician, and that doctor can treat in that location. They have a choice to take our recommendation or not. We are doing what's called a decision-making tool, providing a decision-making tool for those doctors. They then can use that tool, or they can decide to alter it or not use it. Most of our physicians are following right along our recommendations because we have such good success. So
Right.
that's been, so we are in about 10 states. There's 15 to 20 locations that are using the software right now.
But I think what people may not know is that you can be objective with the TMS by using the baseline EEG, and then you follow a patient through the course of the treatment doing repetitive EEGs.
Exactly.
So that their treatment is going to be customized based on the current EEG in front of them. So you're changing the treatment as the patient is getting better.
Yeah, and
that's what I think that makes it different. It's not the same frequency electrical current that you're transmitting to the brain. And so I want people to know that it's different actually what you do. It's not, the protocol's not the same for everyone. It's very specialized.
And the same patient, the protocol keeps changing.
Right.
So it's a response
as they get better.
Yeah, because the brain moves, and we want to change as the patient responds, and then keep accelerating our correction as the computer now is smarter than us, tells us here's a better way to push that patient's waveform, and now we can let that drive the decision making. So that database of the 30,000 EEGs is really smart now, and it's learned what things worked, what things didn't work, and it's a modified machine learning. It'll go toward the full AI, the artificial intelligence eventually. But right now, it's just a very smart machine learned piece of data, set of data. And that's what makes us different, that we have this data set, which is.
Well, it's very fascinating, the work that you do. Is there a patient experience that you could speak about that stands out in your mind recently?
Well,
you might want to show so people could see how it works.
I think one of the cases that was one of the most dramatic to me was we had a patient. I was treating his mother for chemo brain, and a very cerebral palsy stricken kid was coming in with his mother, and he was in a walker and had a lot of contracture, and his hand was stuck up here, and had been that way for 30 some years. He had drowned when he was a 2-year-old, was resuscitated, but then had cerebral palsy, and was really wheelchair bound. He could get up, but it really had trouble moving. I asked his mother, I said, would you mind if we treated him? And she said, of course, nothing else has really been changing his profile. So we did.
Mhm.
And the first thing I noticed was that these patients have a lot of motion artifact and truncal, we call it ataxia, where they can't stay still. That went away. And I was like,
Really? He stopped
yeah,
walking back and
he
forth?
stopped the rocking behavior and some of
Mhm.
the inability to stay steady. And that's, again, something that's hard to fudge. When I saw that, I said, that's remarkable. Then he eventually could lengthen his arm and open his hand.
Oh,
And
wow.
I was treating areas of the brain that standard TMS doesn't treat. And I could do that because of the way we were doing it with less intensity. And I was getting success. So I thought that was one of those, wow, here's a kid who would live his whole life with this disability. He still has cerebral palsy, but some of his symptoms and some of his contracture was greatly improved to the point where he could hold a cup and dress himself more easily. It's just, those are big things for these patients. So that was probably the most dramatic thing I saw. He ended up working for us and helping to write
Oh,
our
really?
software. And then we hired him. And he's
Wow.
a genius. I'm like, my gosh, this is amazing. So sometimes God works in those ways, and he was a pleasure. So that was probably early on. This is back in the early days, but that really struck me.
Well, that's incredible. I mean, I love to hear these personal stories of how people's quality of life change. I mean, I can see in my practice where I see a lot of people that have issues with sleep and energy, and PTSD is something where there's not a lot of good treatment.
Yeah.
So are you seeing that this kind of treatment can help patients with PTSD?
Yeah, and again, I would say that we're not necessarily treating their PTSD. We're
Right.
treating their brain again. Most of these patients have a mixture of anxiety and depression, oftentimes in the same locations. So one part of the brain's going too fast and it's going too slow.
Right.
So they have both the symptoms of, I can't pay attention, but I'm hypervigilant, or I'm impulsive, but I can't make a decision. And that's a very challenging place to be. That's been called now and a PTSD disorder, but really it's a mixture of just anxiety and depression. If we address those areas and see them improve with our treatment, we can watch marked changes in their PTSD symptoms go down. So we've had that. We actually published a recent report on this showing about a 20-point drop in the scoring system that measures their symptoms. And that was accepted to the society meeting a few months ago in Florida on TMS as an abstract. And we're preparing a larger paper on our experience with PTSD. But again, I would say that what I want to make clear to the audience is that we're not treating the diagnosis. We're not making diagnoses. We're not treating any particular diagnosis. We're treating the brain as an organ, just like you would fix your heart. And we call it a brain arrhythmia. When the heart is rhythmic, we fix the arrhythmia of the heart, regardless of what someone's diagnosis is, fix the arrhythmia. If the brain's arrhythmic, we want to fix the arrhythmia and tune the brain. Let's tune the brain first and then decide if you really have those symptoms that you're having. Maybe they're just a manifestation of your brainwaves being misaligned. And we know it is. We know it's the case. So it's a bit disruptive to talk about the brain this way, and certainly it has its controversy because it's not conventional thinking.
I think, though, that there are people out there that would like to try other treatments that don't involve surgery or medication. And if it's something that is relatively safe, it's nice to have alternative treatments, especially for conditions like the mixed anxiety and depression, which there are not a lot of good treatments or resources for people to go to. So I love that you have this available. How can somebody contact you? How can they get treatment from your place?
Well, if they're in San Diego, we have a location here. We have locations in about 10 other states. Our website, prtms.com. So it's prtms.com. Maybe we can give that to your viewers. That's a site that goes and shows our locations around the country and who's using the software. It's a modified list because some are new and have not been put on there yet. And there's some other facilities that are doing work privately, quite a few, who are testing this and working at the highest level. So we're very excited by that. But we do have the ability to treat in these 10 different states. And then here in San Diego, of course, I have a clinic called Mindset. and mindset is here in Del Mar, and that would be a location for patients that are in the area.
Well, I'm so happy and so grateful that you are here for us in San Diego.
Very nice.
And you're a great resource. And I think that the brain health is something that we definitely need to be better with, and having this alternative that's safe and can definitely help with symptoms such as headaches and depression and anxiety. I like that you're looking at the symptoms and you're trying to see how to increase quality of life, and you measure that in the beginning and you measure it throughout the treatment process. And I think that's what's important. And your patients are the ones that are telling you whether or not they're getting better or not. And I think that, it's important work. So I appreciate that you're taking your time out to come and see us. So for everyone that's out there, Dr. Kevin Murphy is going to be a great resource for you for your brain health. And I'm so happy that you had a chance to speak with us today. Thank you so much.
I am too. I think what you're doing, Melinda, is awesome, because we need to take the stigma away from mental health and from patients that have any sort of disorder. But that stigma is reduced by this kind of therapy. We're not treating the disorder. We're not labeling people. We're just fixing their brainwaves. So thanks so much.
I love that.
Yeah.
Fixing the brainwaves.
Yeah.
I'm going to come in and have you fix my brainwaves as well.
Yeah, I treat myself. It feels great. I sleep better, and I feel good, so.
That's the benefit of having the toys with you, right? You get to help yourself.
Exactly.
Well, thank you so much.
Okay.
Thank you so much, Dr. Kevin Murphy.
Right,
Dr. Melinda Silva from Ask Dr. Melinda saying bye-bye and take care.